In this video, I'm going to show you how to do a nerve slider glider exercise. So these also get called flossing, nerve flossing, neural mobilization, and it is all about getting a specific neural pathway moving a little bit more fluidly within its neural sheath, within the tunnel that it travels in through the course of the nerve. So sometimes you get a little bit of maybe extra inflammation or a bit of kind of stickiness at some point along that pathway, and this exercise can get the nerve just moving, encouraging a bit more movement, also potentially reducing some inflammation in that area, and the inflammation can be causing that stickiness. So once it gets moving a bit more fluidly and easily, then the symptoms can often settle down. So if we think about a nerve, I've just got a speaker wire here, sends signals the same as the nerve does. So if we imagine that this is coming from our spinal cord, maybe this end is plugged in to the spinal cord, and it's the nerve root, and then it joins up with lots of other speaker wires, lots of other nerves, to form the big sciatic nerve, which runs all the way down the back of the leg and all the way down to the foot. Lots of branches coming off other nerves. And if we lengthen this nerve out, you can see this doesn't really have any stretch to it. A nerve has a bit of stretch. It can stretch a little bit of a way, but there's a certain point that it doesn't want to stretch anymore. So if we were to just stretch it, that's called a nerve tensioner exercise. So we can either do an exercise where we stretch it like this, or we can do what we're going to do in this video, which is a nerve slider glider exercise, nerve flossing. So we're going to pull it at one end and release it at the other end. To do sliding and gliding, we imagine we get this kind of movement back and forth. So it's like moving back and forth within a tunnel. So the way we're going to do that is sitting on a chair. This exercise started life as it's an orthopedic test for nerve mechanosensitivity, which is how sensitive a nerve is to stretch and movement. And so to do the test, we take ourselves right to the edge of how far that nerve likes to be tensioned. So you can start off by doing this test just to see where your starting point is. Sitting on a chair, hands coming behind your back if you can, and then slumping yourself all the way down. So chin down to your chest, rolling yourself right down. See, you're forming a big C shape between kind of the side behind your knee, all the way up your spine, and then around over the top of your head, a big C. And from here, the test is to slide the symptomatic foot out away from you. Toes come up towards the ceiling, and you're sliding the heel out away from you, and lift it until you get onset of your symptoms, and then come back in again. Don't go into symptoms. You're just going to see how far you can go with it. So that's the test. That's the nerve tensioner. And then if we want to turn it into a slider glider exercise, where we're just getting the nerve sliding and gliding and moving, then we need to bring the tension in from this end, but we need to let go at this end. So we're going to raise the head up. So letting go at the top of the spinal cord, and then tension in this end, pulling up at the top of the spinal cord, but letting go at this end. So what I like to visualize when I'm teaching people to do this is that you're kicking a football up in the air. So imagine there's a ball or something here down around your foot. You're looking all the way down at the ball, and then you're going to slide your foot out and kick the football up towards the ceiling. Look up, follow it all the way down with your eyes to come back down again. So we've got this movement. Now with this exercise, you can overdo it quite easily. Nerves, especially if they're already a bit irritated, don't like having lots of extra force and stretch and things put through them. So we need to be quite careful with it. I would normally recommend just 4 or 5 repetitions at a time. Just going to the edge of your symptoms. Doing that maybe 5 times over, see how you feel afterwards. If things aren't feeling bad, try it again. If few hours later. And if you can kind of go with doing this, 4 or 5 times, 3 or 4 times through the day, so little and often, monitoring your symptoms, checking back, seeing how it's making you feel. And as long as the symptoms aren't getting worse, hopefully they will start to feel a little bit better. And you can gradually turn it into a bit more of a nerve tensioner where you're maybe not looking up quite as much. And then maybe you can go into doing this. And if you can get to the point where you can do this, it's not bringing on your symptoms, hopefully that tells you that your nerve is now nice and happy to be stretched all the way and it's feeling a bit healthier. All right, good luck.